Hey everyone, Dr. Michael Breus, the sleep doctor here. You know, sleeping with the partner is one of the best things in the world, but depending upon the partner, it could also be pretty difficult. My dear friend, Dr. Wendy Troxel, is one of the leading researchers on couples and sleep, and she's helped hundreds, if not thousands, of couples navigate their relationship and their bedroom. She's a licensed clinical psychologist with a specialty training in sleep like me, and she's also the author of this book, Sharing the Covers, which, by the way, I recommend to almost every couple that I have about sleep. We talked about how couples can best navigate their sleep, their bedroom, and any troublesome snoring bed partners. So, first of all, I'm super excited to have the opportunity to talk to you today. When we look at couples' sleep issues, what would you say, in your experience, are the 3 to 4 that seem to come up on a pretty regular basis? I've got my guesses, but I want to ask the expert.
Okay, well, I'll be interested to see if we're internally consistent.
Yeah.
I would say the big ones that I see and that we talk about the most, snoring, number one.
Got it.
It's, the butt of many jokes and the
Right.
bane of many couples' existence.
Oh, yeah.
And a real problem for both partners because it can be so disruptive to both of their sleep quality.
Sure.
Beyond snoring, I would say, insomnia, as well as sort of more insomnia, which is a clinical disorder, but
Right.
also sort of more generally, people who are restless or light sleepers
Okay.
tend to have more challenges when, sharing a bed with a partner. And then the third
So let me ask you
category
about that one.
Yeah.
Is do you think that is when they share a bed partner with somebody who sleeps really well? Because what I've discovered in my clinical practice is it's almost impossible to get two insomniacs in the same couple.
Yeah.
Right?
It's
Isn't that weird?
I don't see that. Yes, I totally agree with that. And instead, what you get is one person with insomnia who is so bitter and
Yes.
resentful that, my
Yes.
partner falls asleep at the drop of a dime and I'm up all night. Why
Right.
is it so easy for him to fall asleep? Yeah, so it's often this
Okay,
mismatch with a light sleeper or a person with insomnia paired with somebody who sleeps sort of blissfully every night.
Right. Absolutely. Absolutely.
So there's sort of the insomnia, sort of
Right.
just someone who, and I like to characterize this as people who generally have sort of lower thresholds for arousal or for being awakened at night.
Yeah.
And so any sort of stimulus from the environment can disrupt their sleep, and their partner often is the one who gets blamed for it. And
Yes.
maybe the cause, but it's often not the only cause.
Gotcha.
And then the third category that I see is sort of differences in sleep schedules.
Right.
Where I totally agree with you. I rarely see two people with insomnia paired together. We often do see mismatched pairs
Oh, yeah.
in terms of their circadian preference. So one's a night owl,
Right.
one's an early bird.
Yep.
And one of those like extreme sort of circadian types ends up sort of going along for the ride with their partner on a schedule that may work perfectly well for their partner, let's say an early bedtime, early rise time, that might work perfectly well for the early bird partner, but is totally inconsistent with the night owl's circadian biology.
Right.
And so they're trying to override their biology
Sure.
in order to be compatible with their partner. And that simply doesn't work most of the time.
Exactly. I mean, and I love the fact that you recognize the resentment that shows up because, by the way, it's bidirectional, right? And so I find for the people that can sleep really well, they're like, what is wrong with this person? Like, I know I married them and I know I love them or what have you, but like, what's going on over there? I don't get it, right?
Right.
Versus the other person who's like, how can this possibly be? How can they close their eyes and instantly fall into a state of bliss and I'm stuck not being able to do such a thing? And so what ends up happening is they place judgments on the partner and judgments on themselves. And I would imagine that
Exactly.
that dynamic fuels even greater anxiety associated with bedtime and probably leads to even more insomnia.
I think that's a great point. And I think what it also speaks to, which is sort of a major portion of my book, was just this assumption of automatic compatibility
Yeah.
through the roughly 1/3 of our lives we spend asleep.
Hopefully.
Now, most people know that relationships take work during the daytime, right?
Right.
But we have this belief, and it's a very firmly entrenched belief, that when it comes to the bed and the marital bed and the bedroom, couples just sort of inherently, if you love the person, you should be 100% compatible.
Right.
And that's just, such a misconception. That's a lot of time. In fact, it's probably the most concentrated period of time that two individuals in a relationship actually, spend together.
Yeah.
And yet we're assuming that it should just be blissful from the get-go. And therefore there's never a conversation about it. There are all these assumptions and judgments and resentment that can build when couples don't talk about, wow, well, maybe we're not perfectly compatible, but we still love each other.
Right.
This is something to work on.
Yeah, I don't think people think about working on their sleep together almost ever. It's this kind of insular, my sleep is here, your sleep is there type of thing. And let's be fair, most couples don't even talk about it before they're sleeping together, right? It's
Nope.
like all of a sudden they've been thrown into a situation where you've now got a bed partner, and what time do they go to bed? And how do they like the thermostat? That's the big one that I hear the most about, is the thermostat. Other than snoring, is the thermostat. She likes it warmer, he likes it cooler, she likes it cooler, he likes it warmer, or both parties like it. Again, it doesn't matter what your sexual preference is. What does matter is your individual preferences here are very, very interesting for a lot of folks out there. And so I don't think people think about it beforehand almost ever. My question to you, which is kind of a little bit on the different side, is I've noticed when I actually make a recommendation to people to consider sleeping separately for a particular period of time, they take offense and feel as though I am saying something about the complexion of their union, of their partnership, when I'm not saying anything about that. Have you had that experience where people are like, we have to go to bed together because that's part of the strength of our relationship? And how do you start to overcome some of those ideas?
Oh, it happens all the time. And this again gets back to this really sort of socially prescribed idea that we have that is very deeply sort of embedded, I think, in our psychology, that the marital bed is sacred and it means one thing for all couples for all time. Well, the reality is that's simply not true. In fact, our beliefs and our sort of the trends and stigma regarding the marital bed and whether couples should sleep together or apart, that has changed dramatically throughout the course of history, right? I mean, we know in the Victorian era, for instance, it was really, a sign of sort of status and prestige to be able to sleep apart. Because frankly,
because you had a big enough house to have two bedrooms.
You have two bedrooms. Right. And the bed was often, in historic times, the most expensive piece of furniture. So to have the space and the resources for more than one bed and more than one room was certainly a sign of prestige. There was also some sort of beliefs about the lack of hygienic aspect of sleeping together. So, back in, throughout history, we've had very different views about sleeping together versus sleeping apart. But really sort of since the 1960s, we've really moved towards this idea that sleeping together means something deep about the quality of your relationship union. Right. And so that's where, as a clinician who even broaches the topic of, might you consider this as a strategy, sleeping apart even temporarily? Well, it really can be a trigger for people about, issues of, the marital bond.
Intimacy is the biggest one that I hear. Is if we're not sleeping in the same bed, then we're not having sex. And if we're not having sex, that's having a big problem in the relationship. And then we got a real problem on our hands. So we need to all stay in the same bed 100% of the time. So usually my first reaction is, are you intimate every night? 95% of people are not intimate every night. Okay, 95%. So I said, okay, so could we schedule intimacy so that you were guaranteed to have that intimacy, but then you could also have an environment that could be a little bit more conducive to your sleep? And then they stop and they think about it for a second. They're like, I hadn't thought about it. I mean, it's so obvious, right? They say they haven't thought about it, right? And so we start to kind of get to some of those challenges. I have another challenge for you before we get into some of these treatment modalities and ideas of how to help people. Pets in the bed. So I'm going to admit to you right here, right now, I have two French bulldogs. They're both in my bed all night long. There's nothing I can do about it because my wife likes them there. And I kind of like them there too. They're kind of snuggly and they're kind of warm and they're kind of good. They do snore. One of them does. So there's a little bit of disruption there, but What is your general idea around pets in the bed? When do you make exceptions? When do you not? Like, help us understand a little bit more, because sometimes beds can get pretty crowded.
Absolutely. It really becomes three's a crowd when you've got, a partner, a pet, maybe a child.
Yep, that was my next question,
weaseling
was
their way
about
into bed.
kids.
Yes. Well, I love these questions because what they all speak to is really what drove my interest in the social context of sleep in the first place. Sleep is a vulnerable place
Yes.
for us to be in as human beings, and yet we know it's critical for our survival and our well-being. And yet, so we as human beings, we derive a sense of safety and security generally from our closest connections and our attachments, whether that be, with a romantic partner, or even with our pets. Pets are really important sources of attachment.
Oh, yes.
And they can certainly make us feel safe and secure. So while I can tell you, and I'm sure there is research to show that, pets can be a, significant source of sleep disruption at night, not only because they snore and they dream and they have their little legs kicking at night, but also many people who may not even be aware of it may be experience of allergens to the pet dander, which can instigate some sleep disordered breathing.
Sure.
So there may be sleep disruptions. That said, just as I never take a hard line with couples who are struggling with whether to sleep together or apart, similarly with people who are struggling with whether they should sleep with their pet or not, I really want to sort of honor and acknowledge the reasons why many people do want to sleep with their pet, even if they also acknowledge that at times they sleep worse when sleeping with their pet. And the interesting thing is the research in humans and in romantic pairs bears that out completely in the same direction, that we actually do show in studies when, people sleep with a partner versus sleeping alone, objectively, there may be some more sleep disruptions when, sleeping in pairs. But if you ask those same people, do you prefer to sleep with your partner or do you prefer to sleep alone? They'll say they prefer to sleep with their partner. And that, again, I think really speaks to that psychological benefit that we get from sharing a bed with a close attachment, and that could be with a pet. But, sort of buyer beware, and, that you may, if your pet snores a lot, thrashes a lot, tosses and turns, you may want to sort of like think of the balance of how much is your sleep being objectively disrupted versus how much are you benefiting from the closeness and comfort of having a cute little cuddly pet share the bed with you.
Right. I agree. There's kind of this balance that has, and I also have done this with some patients. I'm curious as to your thoughts, is sometimes I turn to people and I say, let's run a quick experiment, right? It's only going to last for a week. Let's try this, right? And here's the problem, though, is you can't really negotiate with your French bulldog. It doesn't go particularly well, right? Especially when he's used to sleeping in the bed. So when you lock him out of the room to run the experiment and he scratches on the door for hours and hours and drives everybody crazy, like, you'd have to take some of those things into account. So what I do is I try to tell people, go on a vacation. You're not going to bring your animal with you, and monitor your sleep. And tell me if you sleep better on the vacation than you do at home. And now I get it, there's lots of differences between stress and environment and things like that, but just kind of looking at this one particular factor to kind of open their eyes to this as an idea set. And a lot of times people will do that. I've also found that I can move the animal from the bed to another part of the room, and that can work out quite well, depending upon the animal. I don't know how to train a cat. I don't think cats are trainable. I'm pretty sure they're not. So if you've got a cat, I think you're in for a snuggle bunny, whether you like it or not. Because that's just how that one works. All right, on to the next problem, kids. Okay, so depending upon the age of your child, I mean, hopefully you don't have a 12-year-old wandering and wanting to sleep in your bed anytime soon, which can happen. But when we're talking about itty bitty teeny tinies, like, how does that work out for folks? And sort of what are some of the things that you've seen in your practice that have been super duper disruptive, whether it's at the infant stage or moving on into the toddler middle schooler range?
Yes. Well, when I see couples generally or families who are struggling, with sleep in an infant or a toddler, where I always begin is asking both partners, sort of what's your goal here? I mean, I sort of know in general that, they're struggling because their infant or toddler is, disrupting their sleep.
Absolutely.
And we always, and I always allow the time for each partner to answer this question. And it often goes like this. One partner will say, I just want my child to sleep through the night.
Right.
And the other partner will say, I just want my child to sleep through the night in their own room.
Their own bed.
Those, 4 additional words are the difference between night and day.
Oh, yeah.
And the couple often may not be completely sort of aware of how big a discrepancy those two statements are.
Sure.
And it actually gets back to your behavioral experiment with a pet.
Right.
Just like a pet is not going to respond well to, one night, let's try this out. Sleep in the laundry room, and then the next night you get to sleep back in your comfortable, safe place with your owner.
Yeah.
Again, this gets back to sleep is a vulnerable state. And one of the ways we create safety and security is through predictability.
Right.
So, what often happens with couples and, with young families that, where I come into play is that there's conflict because it really hasn't been sort of explicitly acknowledged that one partner is fine with the child sleeping in the bed. The other partner really wants the child, to sleep in their own bed. And what ends up happening is they're inconsistent with their behaviors and their routines. And that's just not fair to the child.
Yeah.
Because, it's the back and forth of, let's try this, let's have them sleep in their own bed, but then abandoning it and then letting the child come into their bed. And really, it's asking too much of children, especially young children, to be able to adapt and be so flexible. When, of course, what they want is, what feels the most comfortable and safest, which is actually sharing
Sleeping
a bed
with mom and dad. Absolutely.
with
Who
mom
wouldn't
and
want
dad.
to? Right?
And again, but if that's not working for mom and dad, again, there's strategies to approach this, but consistency is key so that the child starts to sort of have some predictability around what's going to happen at night, even if initially it's not what they want.
Right.
So it's first aligning the partners in, okay, what do we really want out of this? And let's voice it so we can own up to it and make some strategies and align together if there's currently some misalignment.
So I couldn't agree with you more. And what I've discovered so I had problems with both of my children wandering in the middle of the night to want to sleep. And I mean, let's be honest, we're sleep doctors. This shouldn't be happening in our houses, but of course it does because we're human, right? And so what we did with my son Cooper was bribery. Bribery worked better than almost anything, right? And so here's what we did: was we put a digital clock in his room because he knew what numbers were, and we said. And we had a piece of paper that says, when you can match this up and it says 630, you're allowed to come out, and then you can come into our room and there's a basket by the bed. And in the basket are Hot Wheels cars, okay? Because my son is a Hot Wheels junkie still to this day, right? Sure. So we went to the store together when he was really young, and I said, pick out 10 of the coolest Hot Wheels cars you could, and he has no idea what's going on, right? Picks them out. We get home and he's ready to rip them all open. And no. Here's what we're going to do. So I did positive reinforcement. You stay in your bed until 6:30 in the morning. You get a car. Next day, same thing. On the third day, rules change. 2 days, 2 nights, and then you get a car, right? 2 nights, then you get a car. All of a sudden, you start understanding how you can shape this behavior, but the consistency of the behavior turned out to be the most important thing. And I'll tell you where we lost control and then regained control was when it happens at 1 o'clock in the morning.
Yeah.
Because
your resources are depleted. You're sleepy.
Exactly. You're
it's
out
hard to
cold,
be consistent.
In the middle of the bed, and you turn your head and then you notice, oh crap, my kid's in the bed. So then you have a decision to make. Do I wake up? Do I get them to get out, retuck them in, disrupt my whole sleep, or do I close my eyes and hope for the best? Right?
I know.
90% of the time, people are going to be closing their eyes to hope for the best. And so what I found out for us was a great decision-making factor was we took an on-call position. So Monday, Wednesday, and Friday, I was on call. So if my son walked in on a Monday evening, Tuesday, Wednesday, or Friday, it was my job to deal with him. For my partner, she handled it Tuesday, Thursday, Saturday, and then we rotated on Sundays. And within 2 months, we were done with dealing with it. But we knew our responsibilities and we knew which nights we were on. And so it made it much less of a deterrent. And because to be honest with you, when it first started, we would fight. You deal with
Right.
him. No, you deal with him.
Right.
I don't want to deal with him. You do, and then all of a sudden I'm getting into a fight with my partner over something that I shouldn't ever be fighting about. Right.
Right. Except that it's a big deal because you're both sleep deprived. And so
Right.
that kind of sort of proactive and intentional co-parenting and partnership is, exactly what I try to encourage families to do. To first of all realize, this is not going to happen overnight because your
Wouldn't
child
that be
is
great?
very real. They have legitimate reasons for wanting to sleep with you. It's
Yes.
just that it's not working for you.
Mhm.
So first of all, plan it well.
Yep.
If you're going to approach this, don't expect it. It's not going to happen overnight or even in a few nights.
Right.
It could take months.
Mhm.
So try as much as you can to plan it during a time that's, not going to be overly stressful for you as a family.
Right.
And yes, plan how you can sort of collaboratively with your partner manage this so you both aren't, just chronically sleep deprived and sort of, it's really not pleasant to be awakened by anything in the middle of the night. So, but knowing that it's not your job every night is a
Exactly.
great way to really partner with your partner and have a effective collaboration around this instead of, again, resentment often
Oh, yeah.
builds in young couples. It's no accident
Nope.
that we see a precipitous decline in marital functioning. Around the birth of the first child,
Yep.
actually.
Yeah.
And it's a lot because people are sleep deprived.
Right.
There's just more conflict to be had
Right.
around these new roles and responsibilities.
Oh, sure.
So that's a great example of how couples can actually manage that, sort of demanding time, which is stressful because sleep deprivation is
It
a
takes a toll.
stressor. How you can collaboratively manage that together.
I agree. Now, I had a situation that I'd love to describe to the audience, and I think I know exactly what your reaction is going to be, but I'm curious. So I had a couple who had a child that would wander in. Now, this was a child who was, I think, maybe 5 or 6, right? So kind of a little bit further along, should be sleeping in their big boy, big girl bed by now and so their pediatrician told them to give their child melatonin or Benadryl to basically dose them to force them into falling asleep. I'm going to be straight up. I am completely against this idea. I think it's one of the worst ideas I had ever heard, but I'm finding it to be more and more common because most pediatricians don't really think about melatonin the way they probably should, that it's a hormone, that kids have plenty of melatonin on board, that there's no reason. And oh, by the way, you're telling this kid that they need a pill to sleep? Probably not the best idea either. So I'm curious, have you had those experiences and do you have a similar thought or are there any other ideas surrounding that topic?
Well, I think any one of us who, sees individuals or families or children in a clinical sleep practice, unfortunately, sees this now all too often. And it's really pretty horrifying for sleep medicine specialists because there's no evidence that, for most people, including children, that taking melatonin, is effective for treating sleep problems.
Nope.
B, there's such an issue with the lack of regulation of melatonin, particularly in the U.S. And when I see, children or teens who are taking 10 milligram doses of melatonin that are supraphysiologic doses, well over what our bodies naturally produce, that's just highly questionable.
I agree.
And as you said, I think this idea of sort of establishing in our children this idea that, there's a pill, there are pills for when you need to be up and there are pills for when you need to be down. Let's sort of go, no go, as the military would call it.
Uses,
That's a really dangerous sort of philosophy around healthy lifestyles for children to start adopting. And they're modeling from their parents and their parents' behavior. Now, again, for some, I think there are some cases where, for particularly short term, melatonin can be helpful if really followed under the close supervision of of a sleep specialist, ideally, who knows something about the timing and dosing of melatonin. But this sort of, wild distribution of melatonin with very little sort of management or understanding of what it actually does, and using it for a long term, particularly among children that have a very sort of dynamic hormonal milieu going on internally, we really don't want to be dosing them with any sort of external pill.
Yeah, I couldn't agree with you more. All right. I got another one for you. This is a big couples one. This is one I've definitely faced before, both personally and professionally, is the bed. So
Bed.
some people like firm, some people like soft. One person's got a bad back, one person's like that. So how do you negotiate that? Because there, in a lot of cases, both people are sleeping on the same piece of equipment. So do you, like, one of the things I'm always doing is I'm having couples like buying the mattress together, right? Whether that's online or in the store, but really coming to the conclusions together and understanding how it affects each other turns out to be really, really important. Also, I use a lot of toppers, right? So they might buy a mattress that's very, very firm because one person needs it firm, and a person who needs it less firm, they can add a topper to it to, again, just try to personalize their space and make it more for themselves. In your kind of research and dealing with couples, is the bedroom environment, the bed itself, something that you see is problematic as well?
Yes, the bedroom environment as well as sort of habits around,
Okay.
sleep, are sort of, again, major issues that, couples, sort of assume that they should be automatically compatible with and are sort of shocked and dismayed if
Right.
they're not. The great news is when it comes to the bed, there are lots of options now that
Right.
allow for a shared sleep experience, but in an individualized, that each partner's sort of individualized preferences
Right.
can still be met. And so, one of the strategies that I recommend to some couples who struggle with, different sort of comfort preferences, different temperature preferences
Right.
of the mattress, they can try what's known as the Scandinavian method.
Right.
Scandinavian method
Yep, two
is
of 'em.
essentially 2 twin beds put together equals a king.
Right.
This also is a great strategy for those who really want sort of the separate sleep experience, but want the opportunity to come together,
Right.
for intimacy, etc.
Yep.
But they also like the appearance of a shared bed.
Right.
The Scandinavian bed sort of or method gives you that approach.
Yeah, I was
The
actually
other
in Scandinavia once, and it was really interesting because there were two twin beds next to each other when my wife came in. And what was even more interesting is there were two different comforters. So we each got our own, like nobody was hogging the covers.
Yep.
Right, because we each kind of got our own comforter, and it was really funny because I had a patient a couple of years later who was cold all the time and one who was hot all the time as a couple, and so I ended up putting her who was cold all the time in a sleeping bag
Mhm.
right next to the partner who had a very thin cotton blanket and sheet, and it worked out perfectly because we were able to. It's kind of a modification, if you will, of something like that.
Absolutely. And, again, you find a solution that fits the problem. And
Got
so for couples who struggle with differences in temperature preferences
Right.
or difference in mattress comfort preferences, or a partner who tosses and turns or who is a sheet stealer, the Scandinavian method might be a strategy for you because you can not only have individual beds, you can also have individual bedding. And again,
Right.
one common sort of overlay that you pull back
Right.
when you go to sleep. But it's really about matching the solution to the problem within the couple.
So it really is about being under the covers, as your book defines.
Yes.
There you go. All right, so I'm going to bring up a term that neither you nor I like, but I think it's important to talk about, is people are using the word sleep divorce these days. And I'm just going to be honest with you, like divorce has so many negative connotations to it.
Right.
I don't love the term, but it does help describe, in some cases, a separation. So my first question for you is, I'm guessing, I think I know the answer, that you hate the term sleep divorce, and you probably have some better terms for that. So we'd love to learn what those are. And then when does it make sense to look at a separation? And then what happens to said relationship post-separation, I think is what a lot of people want.
Well, so you guessed it. Yes, I'm vehemently opposed to the term
Sleep
sleep
divorce.
divorce.
We're on the
But
same
I
page.
get it. It happens to be catchy. So that's
Right.
why, so
Mhm.
I understand why it's still with us and doesn't seem to be going away.
Right.
But of course, anytime you use the word divorce in any context related to a relationship, there are negative connotations. And it again helps to reinforce the stigma that, again, is, societally born, but not really based in science or reality,
Mhm.
that a couple that sleeps apart necessarily has problems in their relationship. And that really puts couples in a really sort of stuck place.
Yeah.
They're worried about being judged. They're worried that, this is going to mean something negative about their relationship. Instead of focusing on what really matters is, what do I and my partner have to do to ensure that we're getting the best quality sleep we can,
Got it.
so that we can be a better partner to each other. Because what we do know quite sort of solidly is that healthy sleep is vital for healthy relationships.
Right.
So that's where the conversation needs to go, not to some catchy term such as sleep divorce. So if it were me, if I could sort of wipe that
Right.
term from our language,
Yep.
I would say, couples need to find a strategy for a sleep alliance, whatever that
I
means
like that. A sleep
within them.
alliance. That's a great term.
It may mean sleeping together all the time.
Right.
It may mean sleeping apart all the time or some of the time,
Mhm.
which is, by the way, a strategy that more and more couples are opting for,
Yeah.
is recognizing we don't have to be all or none in this sort of thinking about our sleeping arrangements. There may be some legitimate times where, maybe the demands of work are really high, or maybe you have a work schedule that is really incompatible with your partner's sleep schedule. And so instead of sort of sticking to this rigid belief that we have to sleep together every night, no matter what, sort of allowing the possibility that, well, maybe at specific times when demands are high or schedules are incompatible, we'll temporarily have a sleep separation so that we can ensure that we're both getting better sleep. Or maybe you have a sick child, or,
Or a sick
a
dog,
child
or
that's
whatever.
going through some nighttime sleep issues, or
Right.
maybe you or your partner is recovering from a surgery or some sort of illness and their
COVID.
sleep is disrupted. COVID,
Right.
right? These are, and I think actually it's interesting that you mentioned that. I think that's one of the reasons why these sleep separations are becoming
Yep.
sort of more
Popular.
prevalent.
Yeah.
I think some couples experimented with this, or were forced to during COVID. If one partner had COVID, they chose to sleep apart to try to reduce the risk of infection, and they may have found, wow,
I slept
this
a lot
wasn't
better.
this wasn't the end of the world. Our relationship, didn't go, down the tubes immediately. So it's these types of behavioral experiments, as you mentioned earlier, that I think it's such a great way to use real data from your, sort of personal, and coupled relationship to understand, okay, do we have to think about this in such an all or nothing way?
Right.
Might there be sort of an in between where we both would benefit? And then you can actually sort of test out these sort of extreme, catastrophic beliefs about what it's going to mean if we temporarily sleep apart. What I find, and you also asked about sort of what happens when couples return to sleeping together.
Right.
For couples who do this sort of temporary strategy, they often find that there's this real benefit of temporary sleep separations. It's sort of like if your partner travels for work and then comes home, you have this sort of lovely reunion for many couples where, you can see sort of intimacy spike.
It's like
There's
makeup
just sort of
sex, but you just get to have it multiple times a week. It's exactly right. It's just like that. I agree with you. I also found, this is interesting. I'm curious if you've discovered this as well, is I find that when people have a schedule where maybe they're not sleeping with their partner every single night, that intimacy becomes more frequent and better because it's scheduled, if you will. Like, I know every Saturday night that I'm going to be in the bedroom with my partner, and there we go. And then, so you're not thinking about it, you know what I'm saying, during the week or what have you. And all of a sudden, intimacy gets more consistent, which is better there's lots of data to show that it's better for relationships and things of that nature. So I think there's a lot of benefits. One question I've got for you is, how do you figure out the schedule for people? Because I've come up with a couple of different ones, and sometimes they work and sometimes they don't. So like, I had one where if somebody is a professional during the week and they have to be up early and on that during the week they're in the guest room, or the other person's in the guest room, and then come Friday, Saturday, Sunday they're sharing a bed. I've had sometimes where it's every other day, so it doesn't necessarily matter what day of the week it is, but just I with my partner one day, without my partner one day, with my partner one day, without my partner one day. What have you found to be some of the schedules that make general sense for people, or that people might want to consider trying?
It really is going to depend, again, on the nature of the problem.
Okay.
If it's sort of a work-related or schedule-related issue, what I often find with couples is that the angst and conflict that comes up around the shared sleep experience, it's amplified, understandably, when we're under a great deal of stress.
Yes.
So we can sort of down-regulate and sort of that stress level by sort of saying, okay, during the work week, for instance, when the demands are really high, maybe that's when, you experiment with sleeping apart. So you really prioritize just getting the sleep you need, and so that you can sort of manage the stress of, the week. And then you come back together, you sleep together during the weekend when, demands are lower, when you just have more flexible schedules and when you're just sort of more adaptable and you can cope better. If it's the case of, for instance, what you described, with your young child, where basically the issue is you're trying to mitigate or minimize either one of you becoming chronically sleep deprived, that's where sort of this reciprocal or sort of every other night. So you're just sort of managing the degree to which either one of you is accumulating too much sleep debt.
Gotcha.
So it's going to really depend on the nature of the problem. But again, I think couples who are able to navigate this and negotiate in a healthy and honest and open way, that's truly the sign of a healthy couple.
Right?
Right?
If you guys can work out your sleep, you can probably work out at just about anything, right?
Right.
All right, here's another nuance. What happens as we get older to this situation, right? Because I'll be 56 this next year. As I'm getting older, my sleep is getting a little bit lighter. I do have more awakenings, as one would expect as somebody gets older. Have you seen more issues happen as people get older? Less? I'm sure there's some variation on either side, but what do you think age has to do with this whole issue?
Well, I see, again, couples sort of that run the gamut across the life course, and the sort of the nature of the problems do change. But certainly, as we age, first of all, as you know, our need for sleep, that is the amount of sleep we need, that doesn't actually change that much. It's just that many adults can't achieve that, sort of roughly 7 to 8 hours of sleep per night that we think is recommended. And the quality of that sleep often suffers. So when you have two partners who are aging together, if you have a similarly aged matched partner, just the opportunity or the possibility that either one of you or both of you is going to have more sleep disturbances, that is raised. So when you have two people who have higher propensity to have sleep disturbances and you put them together, obviously, there's just more opportunity for issues to arise. And the types of issues that I see among couples as they age, it's issues such as, pain or some other chronic health condition, the medications we may be taking that can certainly interfere with their sleep. For women, menopause is a major issue.
Just about to ask you. That was my next question.
Ask any woman going through menopause how her sleep is, and you're likely to get a mouthful or an earful. And then pairing that, with a partner who might be, experiencing increased risk for sleep apnea that we know increases also as we age, or may have insomnia symptoms themselves. So there's a lot sort of more factors that can go into sleep disruptions when, both partners are aging. And then when you pair them together, that really, can create issues.
I mean, it seems like to me, and this is just my personal opinion, I don't have any data to back this up, but it just seems like as we get older, it's almost inevitable that either us or our partner is going to have some type of sleep issue. If they don't have it now, they're going to have it in the future, just based on age factors and what's going on in the world today and obesity rates and all these other things. And so I think most people who are watching this video need to understand that if you sleep with a partner of any type, animal, vegetable, mineral, I don't care, that partner can have disruption on your sleep. And as you get older, you can become more sensitive to that disruption, right? Because of the depth of your sleep and medicines that you're on. As you become more medically frail, that induces more sleep disruption. Medicines on board induce more sleep disruption. So there seems to be a whole host of things. I kind of looking through the conversation that we've been having, I feel like communication seems to be the biggest number one thing that has to happen between couples in terms of talking about the sleep problems that they're experiencing based on some of their partner's behaviors and wants and needs, as well as their own. And that open communication seems to be the biggest key to all of this. Am I close?
You're absolutely right.
Okay.
I want to first say, I'm an eternal optimist, and I certainly wouldn't want your viewers to come away with a saying, it's all a downhill slope from
Oh,
here.
no, I agree.
We're all destined for poor sleep when we age. I think having some reasonable expectations is important. And I talk with my clients about this all the time, that, some level of sleep disturbance, frankly, any time in your lifespan is totally normative.
Yeah, pretty normal.
It's normal, right? And I think we get really obsessed, particularly nowadays with sleep trackers, being ubiquitous, of some pursuit for sleep perfection. And that's really, I think, sending the wrong message. Certainly, we want people to prioritize sleep, and we want people to do all the behaviors that we know can support sleep. And there's a really good evidence base for that. And also have some reasonable expectations that the occasional sleep disturbance, whether it be caused by your partner or be caused by some health condition you're experiencing or sort of change of life, that's really normative. That said, if it, is more than occasional, if it's becoming a chronic issue, there are effective treatments that exist across the lifespan, including for menopausal women, including for, older men.
Yeah.
So we don't have to treat sleep disturbance as an inevitability as we age, nor do we have to accept that as we age necessarily, our shared sleep with our partner, if you're somebody who shares a bed, has to, go downhill as well. I think it's just, as you said, be prepared.
Right.
And the earlier you could have these conversations open and honestly, so you're being intentional and proactive about it, the better set up you are to have a healthy communication with your partner.
Right.
What happens with couples is that the topic of the bed is just completely neglected until something happens.
Right.
And then one partner acts in a real reactive manner.
Oh, yeah.
And that sort of reactive manner, such as stomping out of the room and slamming the door and going to the guest bedroom, that's where we can see relationship issues. And that's sort of what breeds this concern that, couples who sleep apart necessarily have a bad relationship. No, it's really when, a partner stomps out of the room in complete frustration that, they might start feeling resentful because they never talked about these issues, and the partner who's left behind might feel abandoned or rejected.
And guilty.
Well, we can really offset that. And guilty.
Right.
If they caused this.
Right.
They caused this distress on the person they love. So we can really sort of offset that and derail that negative train by having these proactive communications about, prioritizing our sleep as a couple and finding strategies that are going to work for us. That is a pro-relationship goal, right?
Yep.
Because when we're better slept, we're better partners to each other.
Oh, I couldn't agree with you. I really like the way you said that. When we're better slept, we're better partners. Like, that's the bottom line, right? Is when we're well slept, we can engage, we can be healthy, we can have fun, we can love, we can do all of the things that we want to do as humans, but we can't do it sleep deprived. That's for sure. We touched on menopause for a second. I want to just double tap on that one a little bit more, because women in particular experience hot flashes, which are incredibly disruptive to sleep. And there are new medications that are now out for women for hot flashes and things of that nature. Help us understand from your perspective, both being a woman and being a woman in sleep, how do you see menopause affecting the couple's relationship? And then what do you see as some of these new solutions? How do you see them working?
Well, it's a huge issue, and unfortunately, it still remains under-investigated.
I would agree with that.
Despite the fact that we're talking about, over 50% of the population.
Right.
And when you see the statistics, that's upwards of, 60% of women who are, either approaching the menopause and the perimenopausal period, or actually have transitioned through menopause. Over 60% are experiencing insomnia symptoms. Some would say even higher.
Right.
We really do need to do more to understand, what's going on and what are the best treatments. And yes, there are sort of new hormonal approaches that are coming out. I would say my understanding of the literature, nothing is so, there's no magic bullet. When people would like to say, oh, well, my hormones are changing, let's treat it with hormones.
Right.
for some women, in my clinical practice, I see that, some hormone therapy seems to work, but it's rarely the magic bullet. There's usually other issues that also have to be addressed. Cognitive behavioral therapy for insomnia is a treatment that works,
Absolutely.
across the lifespan, including for menopausal women suffering from insomnia. But we need to do more to understand this really significant portion of the life course
Right.
where women are, frankly, still, active contributing members of the workforce, where their sleep disturbance can certainly affect their productivity at work, as well as their mood and their family relationships, all of these things that go into healthy aging. So I think the bottom line is we need to do more.
Right.
But for those of women who are out there who are currently struggling, I would say, don't despair.
Right.
There is, some help out there. And, if you're suffering from chronic insomnia, there are behavioral treatments in particular that are quite effective. And so I would look towards those. And we do need to do more as a field to try to unpack this and find more treatments that work for women. And now as the couple, as I said, there's just more opportunity as women are, undergoing or transitioning through menopause.
Right.
Men are also, as
They're
they
going through
age,
andropause,
undergoing
right?
other issues as well, issues of sort of just change of life transitions, all
And
the psychosocial aspect for both men and women as we age is big, and that can
It's
really
huge.
interfere with our sleep. Hormonal changes, physical changes. Many people as we age, our waistbands are expanding, which could increase our risk for apnea, which of course has, a couple's an effect on the individual as well as the couple. So there's all these issues. You may have more pain experiences, other chronic health conditions, as I mentioned. And so all of those really can be brought to bear on the couple's sleep. And again, it's all the more important to sort of be ready and willing to engage with your partner. And, well, how are we going to negotiate this?
Yeah, I couldn't agree with you more. All right, I got two last questions for you. And one of them I'm going to answer as though you were asking me, which is, what's some of the funniest couples sleep stories that you know of? And I'll let you think about that while I tell you mine. And then
Good.
I also want to know about what your thoughts are about sleeping naked versus not naked, because that's been a big topic of interest lately. So let me tell you about my funny couples sleep story, because I'll never forget this couple. They were hilarious. So I was at a PetSmart. Okay, because we've got dogs and we love taking our dogs to PetSmart. It's like a vacation. It's like a little outing. We love it. And so we're wandering around, and this woman turns the corner and she sees our bulldogs, and she comes down and she starts petting them. And I want to be clear, she was not a small person. Okay, so she might have been 5'4". She was probably 180, 190 pounds. So again, not a small woman. Probably had sleep apnea if I had to guess, but I have no idea if she did or she didn't. And so we're talking, and I said, well, what kind of dogs have you got? And she says, oh, I have a Great Dane. And I'm like, oh, I love Great Danes. I grew up, I had 3 Great Danes growing up. It was like living on a horse farm. And she said, well, actually, we have 2 Great Danes. And right as she says that, her husband turns the corner on the aisle. He's about 6'4". He weighs about 350 pounds. He's a mountain of a man, right? And he walks over, and he's got both Great Danes in the PetSmart. So my bulldogs are hanging out with his Great Danes, and we're having the best time ever, just chit-chatting along the way. And I mentioned that I'm a sleep specialist, and he says, oh my God, we've got terrible sleep problem going on. Can you help us?
Yeah.
I'm like, okay, what is it? Both Great Danes, both of them with 2 massive people are in the same bed, and it's a queen. Okay? It's
I was
a
going to say,
queen.
even a California king is not going to solve that problem.
So they had 1 Great Dane in between them, 1 Great Dane along where their feet, and they are literally mashed in there. And I was like, guys, I think I know your problem.
I wish all my cases were that easy.
I know, right? And
they
so,
probably thought you were brilliant.
yeah, oh, they thought I was like the one, right? I was like California king. That's the only way that's going to solve this problem if you still want the dogs in the bed. Or buy a separate queen if you've got room in your bedroom, and put the dogs in that one next to you, and then you're in this one, and figure it out. And they honestly thought that I was like, mwah. They were so thrilled, and that was one of the funniest couples sleep stories I've ever had. So I'll leave it to you if you have any funny couple sleep stories, or if you just want to address the naked sleeping question as well.
Well, that I need a little bit more time to ponder. But, in terms of, I don't know if I can top your funny story, but what does come to mind was one case of insomnia. It was actually a male patient in this case who had really severe insomnia and a very supportive partner, spouse. And one of the things, and they came into the session initially, together, which I often, ask for couples to do so that it can get the partner's experience as well. And one of the strategies that they had repeatedly tried, and they both seemed sort of okay with, although with some pushing, I think the wife was slightly less than okay with, but she was trying to be really supportive, was that whenever he woke up in the middle of the night, and he had severe insomnia, so this could be multiple times at night, 1, 3, 5 a.m.
Right.
And they also had young children, by the way. One of the strategies that he thought might help was if they would have sex.
Yep, I knew exactly where this was going.
And, my level of shock at this poor woman who also was dealing with the young children at home and, who was trying to be game about, I'm doing everything I can. And frankly, it clearly wasn't working because they were coming in to see me. So, but, they were getting a lot of sex out of it. But this poor woman was also, she didn't have insomnia, but she was now sleep deprived.
Of course she was.
And what I love about it, not only was it a bit shocking, but I'm sure there's more than one couple who have tried this approach.
I've heard this story. I've heard this story in clinic, for sure.
The things that people will do to support their partner, the way I framed it for them and what we actually ended up working on in session was, and this often happens, whether it be, having sex with your partner in the middle of the night as a way to try to help them with their insomnia, often the most well-intentioned and supportive spouse will do, in fact, what's the wrong thing when it comes to helping your partner with insomnia. So actually sort of reinforcing, sexual arousal and being awake in the middle of the night is probably not the best thing to treat the insomnia. No. So I get that. As we got him sleeping better and gave him better tools, other than that, I think they both came on board to realize that this was not actually a treatment that was working for either one of them.
So I had a very similar situation, but I solved it in a very different way. So I had a couple and it was the husband who woke up and said he couldn't fall back to sleep unless he had sex. And so I said, okay, fine. Then, you need to consider, pleasuring yourself and not disturbing your bed partner. And the room got very quiet very quickly. And I said, how is that for an acceptable outcome? And it took him a minute. And then he was like, okay, I see your point. I'm not being fair. Right.
Yeah.
Because it wasn't even in his thought process that he was engaging somebody in a physical act, which, by the way, in women has a tendency to alert them, not slow them down. Whereas with men, post-orgasm, they do have a tendency to slow down. So what he was doing, was he was trying to fix himself and he wasn't having any cognition towards his partner and things like that. So I've heard the story before. It's definitely a funny one. And it's certainly interesting. All right. Last question, because I get this all the time, is about sleeping naked. Is it good or is it bad? And I'll tell you what I tell people, and then I'm curious to hear what you have to say. So what I've discovered with most of my couples is sleeping naked has almost nothing to do with temperature, but everybody says that it does. And what ends up happening is one person finds that when both people are sleeping naked, they have a tendency to be intimate. And so that person is actually not feeling like they're getting fulfilled on the intimacy side of things. And so they're saying, I want to sleep naked because in the hopes that they're going to become more intimate and that's going to solve part of the problem for the couple. I've had that happen. And then I have had the temperature argument, which is some people say I'm freezing, some people say I'm boiling. And so less on there to thermoregulate might be inappropriate. So I've actually had it in both situations where I've recommended it. I'm curious, as a sleep and couples expert, how do you see that? And do you see both sides of that? Or is there something else to think about?
Well, my general approach is not to be overly dogmatic about anything when it comes to what's working for you and your partnership when it comes to sleep. The reality is, I think, as you alluded to, this idea that, spontaneous sex that just happens is the only type of sex is just not true of most long-term couples. So I think we need to move beyond this idea that scheduled sex is any less romantic or being, again, intentional about when you're having sex, when you have busy lives, that there's anything wrong with that. And so, I think the motivation for some of like, oh, let's sleep naked so that, we're just going to roll into each other and, automatically, be having sex that's generally not
Doesn't work.
the reason why people are not having sex.
Doesn't work.
Again, there's many other factors that can go into it, and being intentional and planning when you're, going to be intimate with your partner, that's a great strategy. The other piece of this is it's really going to depend on the individual. I know lots of people, including myself, who, sleeping naked could increase your vigilance at night because you're worried about a child coming in the room, or if you had to jump up in the middle of the night and take care of a dog.
Right.
So I think really recognizing that, sleep is this really vulnerable state, and these issues of intimacy are also sort of very vulnerable and very personal. And so we don't want to be dogmatic. Find the strategy that's working best for you. Check in with your partner to make sure that, you're relatively aligned, or you can negotiate on that. But I really don't know of any research that shows that there's sort of one, that sleeping naked or not really has any clear benefits for sleep. It's really about sort of individual preferences and what works for the couple.
Gotcha. Well, I've also discovered as a funnier note that if you're sleeping with pets in the bed, you should definitely not be naked, because there's all kinds of parts of male's anatomy that looks like dog toys that are not, and it could get pretty rough pretty quick. So as a general guideline, my one dogmatic rule is...
You can be dogmatic about that. Yes. I give you permission.
Is if you're going to sleep naked, no animals in the bed.
Hard no.
Hard no on that one for sure. Well, I just want to say thank you so much, Dr. Troxel. This has been amazing. I know that the audience has gotten a tremendous amount out of it, and we're super excited to have had the opportunity to kind of double tap on your experience. Tell us a little bit more about your book, how people can find out about your book, and maybe even if they wanted to contact you in some way, shape, or form, how can they find you?
Oh, well, Dr. Breus, it's been such a pleasure to get to interact with you in this format. We've known each other for a long time. And thanks again for highlighting my book. It's called Sharing the Covers, Every Couple's Guide to Better Sleep. It's available on, every major online retailer. And you can also sort of follow me. I'm on formerly known as Twitter as Wendy Troxel.
X, formerly known as Twitter. Yep.
Yeah, and wendytroxel.com. And I'm also sort of frequently, talking to the media about sleep and on shows like this.
Yeah.
And it's been just a pleasure.
Well, it's our pleasure to gain your level of expertise. So once again, I just want to say thank you. And to the audience out there, Dr. Troxel and I have known each other for quite a while. She is literally the expert in couples sleep. She wrote the book on it. And so if you're having any issues with sleep as a couple, it's the first place I go. I personally go to this. I give this book to patients. I say, read this before you even come in to see me, because there's so much valuable information and so many different things that people can think about in this book. So I highly, highly, highly recommend that. And then again, if you want to find Dr. Troxel, she's out there and available. Or if you want, send an email to my website and I'll get you in touch with her if that's what you need to have happen. So thanks again, Dr. Troxel. I cannot thank you enough. This was so valuable, and I think everybody's going to love it. I love how Wendy emphasizes how important it is to communicate with your partner about sleep. One issue I see often in my practice are couples trying to navigate snoring bed partners. If this sounds familiar to you, you know how disruptive this can be to your sleep and your moods. So do me a favor, be sure to check out my video on how to help snoring bed partners right here. Once again, my sincere thanks to Dr. Troxel for her time and her advice. I learned a ton, and I hope you did as well. This is Dr. Michael Breus, the Sleep Doctor, wishing you sweet dreams.